Dr. Twomey does mention in the forward one of its greatest strengths, speaking about the book, is said in
Mm.
the to be how it separates and defines the science from speculation or hypotheses on that science. Elaborate for us on his assessment and why that's so important.
Well, that's a an issue that's not a balloon, but the size of a zeppelin, because since the first edition of the book, we've been invaded by the notion of evidence-based practice. There was none of that concept floating around at the end of the last century. It was in the 1990s and by 2000 that evidence based practice took a firm foothold. I'm not referring to issues like the stringency of clinical practice guidelines. What I'm referring to is the intellectual dimensions of calling for evidence and then applying biostatistics to analyze the evidence, particularly on matters such as reliability of clinical practice, validity of clinical practice, and eventually the evaluation of treatments to determine effectiveness and efficacy. It's a well established science, and there are guidelines for how do you quantify reliability, quantify validity, quantify effectiveness and efficacy. It's not a matter of opinion, but where are the empirical data that allow us objectively to assess critical dimensions of clinical practice. And that really evolved in a big way since the first edition. And in the upcoming sixth edition, there's quite a bit of that in it. And that's almost like a startling revision to how to write anatomy books, because anatomy was dull and boring. Picture, fact, name, fact, name. There was no contention involved. But when we move from clinical anatomy into what does this mean for diagnosis, what does it mean for treatment, the principles of contemporary evidence-based practice apply very strongly.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.